pregnant and you're having like rib upper back pain, it's uncomfortable, you feel like your baby is always up in there and you don't have enough room to like breathe and it's uncomfortable. So some things you're gonna need for this movement is either a ball. If you don't have a ball, you can use like a countertop and you'll use that standing opposed to what I'm gonna show you down here. And we're just gonna get started, okay? So the first thing you're gonna do is we're gonna do the one at the countertop or with the ball. So if you're using a ball, you're putting your hands on it through here. If you're using the countertop, you're putting your hands on the countertop and you're leaning forward. Since I'm on the ground, I don't really have to lean very far forward, but you're just gonna kind of like gently come down into here and get a good stretch, and you're gonna rock like side to side. You're gonna get a stretch all the way from like your low back, all the way up to your shoulders and your shoulder blade. You're just gently swaying back and forth. If you're at the counter or even with a ball, you could hold that position like off to the side. So if I'm gonna hold this way, you're getting like that curve, like a C curve, and you're getting a really big stretch and you're opening up the rib cage on one side. So you're just gently kind of going back and forth, nice and easy. We're just gonna do a couple more and then we'll move on to a different one. Don't forget to breathe. Sometimes when you get pain, discomfort, you forget to breathe. Okay, do not forget to breathe here. We're gonna do about one more on each side. Okay, one more on each side. I'm gonna let you know right now, I have a hard time counting and talking at the same time. So we might do more, we might do less. I'm gonna put this up here so it doesn't run away from me. We're gonna do a cat-cow. If you don't wanna be down on your hands and knees, you can do it standing at the countertop. And we wanna really emphasize this top part of your back here, the upper back. So as you kind of drop down, if you're at the countertop, your hands are still there and you're leaning forward, you're gonna drop down, you're gonna let those shoulders like sag. Okay, so you're gonna let like your chest sag and you're gonna feel like your shoulders come up a little bit more. You're gonna let it sag and look up. And then you're gonna pull up and you're gonna try and really stretch like this between your shoulder blades, like a string is pulling as high as you can go. Okay, and then you're gonna come on down and kind of drop those shoulders, looking up, get your head up, okay? And then you're gonna push back and really pull that string. String's pulling your shoulder blades all the way to the ceiling, okay? All the way to the ceiling. Up tall, and then you're gonna come on back down, okay? If you're having some pain during your pregnancy and you are not already in Secrets to Releasing Pregnancy Pain or the community that I offer, like the Mama Bundle, then you need to hop in there. With the Mama Bundle, you have pregnancy with less pain, you have labor without fear, and you have postpartum with support. You have weekly Zoom calls that you can hop into if you have questions or you want to hear what others have to say. You have virtual one-on-one support, so you're not left to just a program to figure out on your own. You have someone you can ask questions to and have support each step of the way. So there'll be a link in the show notes here, and there'll be on my website, you can head to pregnancy support, and it'll be there. My website is just pelvicfloormama, MOMNA.com, and you can get some help there. So just gently coming down. Okay, we're gonna do one more of this one, and then we're gonna do something a little bit different, okay? Pulling back up, that string's pulling your shoulder blades all the way to the ceiling, and come on down. Okay, we're gonna do like a thread the needle. So your one arm is gonna go underneath you. I like to bend this arm here that I'm using for support and bring that shoulder like all the way down. But it might not be comfortable for you, so you can go to wherever you are comfortable, but you're kind of coming down, you're gonna get a stretch through that shoulder of the arm that is underneath you. And then you're coming up, and you're looking up and bringing that arm up to the ceiling. And then you're coming back down, okay? Nice big stretch. And then you're coming up and bringing that arm up. Okay, so from like a little bit different angle, you're coming down, and then you're coming up. I'm only gonna do about 5 on each side, but you can do more. You can always come back and do more. So one more on this side, and then we'll switch to the other side. Nice big stretch. So that arm's gonna come through. Get a little stretch. If you like that stretch there, you can hold it for a second. And then you're gonna come on up and look at your hand, follow your arm. Follow your hand with your eyes the whole way through. Come on down, and then come back up. We got one more move after this, and then you will be done. Pull on up. I think we got one more on this side. Again, my counting's terrible when I try and talk. So we'll see how accurate I am. Okay, this next one, you can do laying on the ground. I'm gonna show one side on the ground here, and then I'll show you standing. So you can lay on the ground here, knees where they're comfortable, arms out in front of you, and that top arm is gonna come over and come all the way back. So you're bringing that top shoulder as far back as you can until you get that stretch. But your knees are trying to stay down on the ground, okay? So you can do it laying down like that. If you don't like being on the ground, you can do it standing. So you can do it standing against the wall, one foot, the outside foot in front of the other, and you're gonna open up as far as you can. Nice and easy. You're gonna do 10 on each side. So I did the one on the floor, this is the second one standing, so we're at 3, 4, and you can try both variations and see what you feel best with. 5, 10 might be a lot, but we're gonna give it a go. 6, and you might notice, again, one side feels different than the other. You might be a little bit tighter, have less mobility. Make sure your eyes, it's important that your eyes are following you, following your hand throughout this whole movement. You got 2 more. 9, we got 1 more. 10. Okay, then you're gonna switch and do the other side. I'm gonna continue doing it standing so that they feel a little bit even here. So top arm, opening up, get a good stretch. And again, make sure you're breathing, follow that hand. Follow the hand out. And keep going. I don't know, what is that, 4? I'm terrible with counting. 5, halfway. Don't make yourself dizzy. 6, 7, 8, 2 more. All right, last one. Okay, so trying to create more space through your rib cage, create more mobility through your upper body so you have less pain and so your baby has more room to move, so you can breathe better and get that full breath. Your diaphragm and your pelvic floor really work together. So if you're having issues with your diaphragm and getting that full breath and being able to breathe, it could impact your pelvic floor too. So if you need more support, head over to my website or my primary source. If you want to get in touch with me, shoot me a DM on Instagram, and I'd love to help support you throughout your pregnancy.